So welcome everybody. I think we'll make a start. Good afternoon and thanks for joining us today at the CEIH's Improvement Showcase. So we're really excited that you've been able to take time out of your day today to be part of the showcase, which is Series 9. And it's the first session of Series 9, Improvements Enabled by Technology. So I'm really pleased to be facilitating today. My name's Katie Mayolo and I'm the Networks Program Director here at the CEIH. First, I'd just like to acknowledge that this land that we meet on today is the traditional land for the Kaurna people, and we respect their spiritual relationship with their country. We also acknowledge the Kaurna people as the custodians of the Adelaide region and that their cultural and heritage beliefs are still as important to the living Kaurna people today. So who is the CEIH? I know some of you have probably joined some of the showcases before or are familiar with us, but for those of you who are unfamiliar, we are the Commission on Excellence and Innovation in Health, or as we refer to ourselves, the CEIH. So we are the lead agency for innovation in healthcare in South Australia. We bring consumers, clinicians, and other collaborators together just to turn ideas into better healthcare. And what you can see on the screen right now is our vision at the CEIH. We want to create better healthcare for South Australians. So to do this, we need support on how we can create and imagine these new ideas for that word I keep saying, for better healthcare. And I think I just want to acknowledge with that word better, we're saying better isn't always excellent, but we are committed here to actually measuring and talking about and looking at what we're doing so we can actually see changes and monitor improvements. So we also like to say, what if the big idea was actually connecting the small ideas? And in essence, that's why we host these sessions, and that's why we're here today. We want to join people together across the system, and it's all about connecting South Australians so we can share our stories, we can learn from each other, we can break some silos, know what work is actually being done and undertaken potentially just down the road from us, and ultimately learn from each other with the goal of improving healthcare. So the Improvement Showcase, we're again bringing healthcare teams together. That's what we're doing here. We're trying to provide a space where we can explore, talk to each other and learn about what other people have been doing. We like to keep it simple. We do it at Thursdays at 1 o'clock as we're here today. And if you miss the session, you can always catch up online whenever suits you. They will be posted after the fact. So that being said, a little pitch, we'd really like to hear from you. So if you've got a story to tell, reach out to us. Have you succeeded in solving a problem, or have you learnt something whilst trying? You don't actually have to have solved the problem. What did you learn along the journey? What were the barriers? What can we learn from you trying? Or have you just got some themes that you would actually like us to explore? So contact us at ceihsa.gov.au. We would really love to hear from you. And just lastly, I'll just go through a little bit of housekeeping before I hand over to our presenters today. You can absolutely keep your cameras on while Mark and Michael are talking. They might like to see your nice face, and smiles and head nodding is always good for engagement. I'd ask to keep your mics on mute. That would be great. We are recording at the moment and we are recording the presentation, but we are going to stop recording for question and answers. So you all know, just to allow for that robust conversation, a bit of freedom and opportunity to relax and connect and ask any questions that you like. And for that Q&A, feel free to camera on, call out, hands, you know, the little yellow hands up, or use your chat function. Lee will be monitoring that as well. So without further ado, we do have a little program of the next 3 sessions. And today we're so excited to have Dr. Michael Bradley with us today. as well as Mark Chilvers. Really great for the Telehealth for Dental Emergency Triage, a response to COVID-19 and beyond. And you can see the next Thursday is the 19th. We've got Omega-3 screen and treat program in early pregnancy. And Thursday, the 26th of May, we've got Bring Your Own Device, Challenges for Consumers and the Healthcare Service. So without further ado, I'm going to hand over to Mark and Dr. Bradley for their presentation. Thank you so much.
Thanks, Katie. So let's see if I pass the first test, which is sharing a screen. So
you've done a great job.
Excellent. My name's Michael Bradley. I'll just do a very brief introduction, go through the agenda that Mark and I are going to talk about today. I'll introduce Mark in a moment. Let's see what happens when I click on that. There we go. So Mark's going to set the scene for us, talk about, as we all know, in early 2020 it was when COVID really hit, is the world changed for all of us, and Mark's going to take us back then and set the scene about why we had to develop this sort of strategy, and he'll also give a bit of context about the SA Dental Service, the Adelaide Dental Hospital, and other matters. I'll then go through the system that we developed. If a health service wasn't using or engaged in using telehealth type systems prior to COVID, well, certainly COVID threatening lockdowns forced a lot of us to start thinking seriously about telehealth. So we set up a system. I'll go through what our system looked like. And then Mark, to complete round out the picture, we'll talk a little bit more about other digital technologies. It's not just about telehealth consultations. There's a lot out there that can be used, and certainly Mark is very hot on all of those technologies and trying to make sure that SA Dental is ahead of the game with as much of those as possible. So at this point, Mark, I think I'll introduce you. Your normal job is Executive Director of SA Dental, but you're currently acting as I think as Director of, well, I've got to get this wrong, and it's off the screen now, Clinical Support Service, Clinical Support Services, the Group Director, in fact, and acting there also. We look forward to you coming back to SA Dental in a few weeks' time. But in the meantime, thanks, Mark.
Fabulous. Thanks, Mike. Thanks to Katie and Lee and the team at CEIH. I just start by acknowledging that I meet here on Gunner land, but also, Michael, we've lost the presentation.
Yep.
But I also acknowledge the traditional custodians of the lands across South Australia where we provide critical oral health services. There's a lot of names that I see in the participant list, a lot of friends, colleagues. I just also acknowledge Personify Care. I can see the team online. I'd be very happy for you to drop your where you're from in the chat box, just so I can get a feel for who's around. That would be great. Just a bit about dentistry in general. For those that aren't aware, 85% of dentistry is done in the private sector. So the state's oral health provider provides care for the most vulnerable cohorts and universal access to children. But there's an asymmetry in the roles and responsibilities of public as opposed to the service provision in private. We have the state's oral health plan, and SA Dental's role is, as we said, delivery of care to the most vulnerable and those priority populations identified within the plan. SA Dental is a true statewide service. We have governance through the Central Adelaide Local Health Network, but we are in every local health network in the state, and partner with RFDS and the ACCHOs around South Australia to maximise care provision into the far reaches of our beautiful state. From a dental perspective, we've got over 300 chairs across South Australia. 89 of them are contained within the dental hospital in the AHMS building on North Terrace, and then the other 220 odd in about 40 clinics from Mount Gambier all the way across to Port Lincoln. We've got around 950 staff, which is about 600 FTE. 100 of those 300 odd chairs are dedicated to the training of our future oral health workforce, and we have many hundreds of dental and Bachelor of Oral Health students. working with us in partnership with the University of Adelaide. Typically, for an eligible adult, of which there are 500,000 in South Australia, they wait on average of about 12 months to get access to basic general dental care. We have triage mechanisms for emergency care. And interestingly, only 70% of those who access general care see us once in 5 years. So there's a huge unmet need for general dentistry in South Australia, as there is across the country. For full disclosure, I also chair the National Dental Director Group, and I am not a dentist. But there's plenty of good work happening in that space in national funding reform, and we are all sort of suffering from the same challenges. And there's also not a chief dentist or a chief oral health officer. And hello, Zita from Flinders, that's a familiar face. Thank you. We see around 300,000 to 400,000 occasions of service or visits each year. It's about 75,000 unique adults and 75,000 unique children. And we do partner quite closely with the private sector through the issue of dental vouchers where we can't manage the demand or we don't have the workforce or the infrastructure to deliver. As Michael said, COVID put a sizable strain on dental services. Back in March 20, we progressed quite rapidly through the service level restrictions that were led with quite a lot of influence out of South Australia into the AHPPC. And through a serendipitous connection to Personify Care, we saw the opportunity to work on a mechanism to stratify and triage patients into our service in the event that we hit those highest level dental restrictions, knowing full well that SA Dental and the dental hospital specifically, which provides high-end specialist dentistry, would be a last line of resort. And we couldn't really jeopardise the whole of our service to see patients that may not necessarily have to come to us. Thankfully, we had this tool developed in partnership with Personify from March through to probably July. And then we had the Woodville Pizza Box saga, which Michael will talk about in a bit more detail. But it was there on the shelf ready to go. And Michael will talk you through the numbers of the patients that we're able to put through this pathway and the successful outcomes of that. That's probably all from me. Full disclosure again, I've just contracted COVID this morning, so I might be a bit scratchy or coffee, but happy to take some. If you've got questions, whack them in the chat box and we can come back to them at the end. I think that's all, Michael, over to you.
Thanks, Mark. I think I might put my mask back on now, knowing that you've got COVID.
Well, I'm about 15+ kilometres away, so I should be okay.
Should be safe. Don't cough too loudly, and maybe on mute for the next few minutes. So thank you. So we'll get into the guts of the presentation. I guess you know, the format or the content of the present lot of showcases is about digital technologies, etc. And so we'll concentrate on that for the next few minutes. As Mark alluded to, when COVID really, or the impacts of COVID started really taking effect in March 2020, and there was a real possibility of dental services being severely restricted, is we had to look at a worst case scenario of what happens if we do go into a full-scale lockdown. You know, people are still going to have dental emergencies. How are we going to deal with that when people really can't move around the state, not able to go to their dentist, etc.? How do we deal with patients having emergencies? So the immediate challenges that we faced were, as Mark said, apart from the Adelaide Dental Hospital, which was allowed to remain open as the last resort option, that effectively all other dental services in South Australia could have been shut down. So that's all public sites and private practices. That meant no in-person or very few availability for in-person consultations to assess dental emergencies. All cases, public and private, to be managed by SA Dental. So private practices not operating, suddenly we take on their workload as well as SA Dental's. So a genuine risk, of course, that we could become overwhelmed. We couldn't just ask all patients to show up to the Adelaide Dental Hospital. that meant that we would need to assess patient problems remotely as far as possible. Only critical emergency cases would therefore be able to come into the Adelaide Dental Hospital, or in some cases to the Royal Adelaide, for in-person management. So faced with those challenges, we thought, well, what does the system need to look like to make it possible for us to cope? Fundamentally, first and foremost, we needed to guarantee that patients still had access to emergency dental care. We needed to be able to provide them with something under lockdown conditions. Any system that was set up needed to be quite simple, not only for the SA dental staff who would be required to manage such a system, but also for patients to navigate their way through it. In March 2020, we had no idea how long it would be until the state could be placed into lockdown. So we knew that a system had to be put in place as soon as possible. And we set ourselves a target of a maximum of 2 weeks to have a system in place, should it be called upon. We've also, having lived through those early days, and even since then, seen the rapidly changing environment under COVID, where the regulations changed, the directions changed, guidelines changed, what could and couldn't be done, not only within healthcare, within the dental setting, but also with patient and people movement across the state. So any system that we set up would need to be readily adaptable to that in that ever-changing environment. So as Mark mentioned, we partnered with an organisation called Personify Care, who operate essentially a patient communication platform amongst other technologies. And we worked with them to try and come up with a way to be able to communicate and engage with patients to facilitate this journey of being able to access emergency care. I'll go through a little bit of that technical detail later. We won't get too technical because I'm not that technical myself, but we will go into some detail. But I'll take you through what the patient journey ultimately looks like incorporating those digital technologies. The first thing is that the patient would contact their normal dental service. That's the first thing they would do if they thought they had an emergency, is ring their private clinic or ring their SA Dental Service clinic. If they contacted an SA Dental Service clinic because it was internal, then the call could be automatically redirected to a centralised number. But if they contacted their private practice, then there'd be some sort of mechanism to redirect them to call the SA Dental Service 1300 number. So all calls coming to one point, managed by SA Dental. The calls that were coming in would be varied, particularly in a situation where patients are told suddenly you're not allowed to move around anymore, you're not allowed to leave your home. Unless it's under extreme circumstances. So they might ring to advise that they've got a problem. They might ring to say, oh, I think I need to cancel my appointment. So that was the first filtration point, if you like, in the system, where we had 5 dental assistants / receptionist staff. So these are people who understand dental needs to some degree and can help patients. If they needed to change an appointment, we could obviously say, look, that's, we're aware that you won't be able to come in, and we'll get back to you in a week or two to make new arrangements. So we'd already be able to filter out non-emergency calls at that point. But if there was a genuine need for clinical advice, then those patients were forwarded directly from a receptionist to a general dentist. So we would have 5 receptionists manning the first phase of the call centre. They were paired up with a dentist who would then be able to provide clinical advice to the patient. So the patient could go through the scenario that they were experiencing, and the dentist might be able to help them out. And of course, the idea of that is to maybe be able to filter out patients who really don't need to attend a dentist in person, For example, a patient might say, look, I've broken a filling, and when the dentist talks them through that process and make sure, you know, that hasn't developed into some major problem, if the patient's just got a little bit of a sharp tooth, then maybe that's something that can be managed without the patient needing to attend. But if the dentist who was speaking with the patient thought that there was you know, the potential that the patient would need to make an attendance at the Adelaide Dental Hospital, then they were advised that they would be given a telehealth consultation with a specialist, and that would be done obviously using some digital technologies. So the dentist would then hand over the call, forward the call to a clinic coordinator who was familiar with the Personify Care pathway that we'd been set up, and also trained in the Health Direct video call system for the teleconference side of it. The patient would go through a registration process. They'd be doing that on their smartphone or home PC if they so chose to do that, use that way. And then the patient, after going through this system, would end up with a video consultation with the specialist oral surgeon. And of course, during that conversation, where the specialist is not only speaking with the patient, but can actually see the patient and can start having a closer look at assessing them visually, is come up with whether or not the patient did in fact need to attend the Adelaide Dental Hospital. So several steps through the patient journey that would hopefully limit the number of patients that would need to leave their home to receive emergency dental care in person. But in the meantime, patients who needed advice along the way would be covered. I'm just going to delve a little bit more into the digital pathway itself. We've mentioned Personify Care, the patient communication platform, and also the Health Direct video call telehealth type platform, and we managed to semi-integrate these with the help of Personify Care. So the first thing that happened, just by entering the patient's mobile number into the pathway at our end, is that the patient would receive a message that got them to go through a little bit of a registration process where they would verify their ID, provide consent, and would be given a little blurb on the service that they were consenting to. The patient would then go through the next step of filling out a brief medical history questionnaire. And of course, all of these steps mean that these are things that patient is controlling themselves and not taking up phone time with a receptionist. So they're providing this information to us, but it's not involving direct contact with a staff member for us to get this information. Then once they've completed their medical history, the next step in the process is they received an automatic link to the Health Direct video call platform, and they'd be able to then have their video consultation with the specialist. So all of that was, I guess, developed and thought about. The technical side of it was developed within 2 weeks. We had that up and running by April. And I guess we were sort of waiting. When are we going to have a lockdown? When are we going to need to put this into practice? But as the weeks went by, we thought, look, we've developed this system. Let's start testing it. And so SA Dental in July did roll out using this system, but in a non-lockdown situation. So I will touch on that later, that we were actually managing to put this into practice before a lockdown hit. But then, of course, come November 2020, we had the pizza box lockdown, the lockdown that maybe shouldn't have been a lockdown, but ended up giving us an opportunity to see, could we swing into action? What we did find is that the calls did come in as expected. So these are figures from the first day 1 of the lockdown. 187 calls came in to the 1300 number. The frontline reception staff managed to help 127 patients, leaving just 60 patients that needed clinical triage, so those calls being put through to the dentist. The dentist then discussed with patients, helped 46 of them out, not needing any further care. 14 of them, though, deemed to require a specialist consultation via video conferencing. And out of that, the specialist at the end of it all deemed that one patient needed to present. So we had one patient out of 187 phone calls that actually needed to come into the dental hospital with a genuine emergency that needed immediate care. I'm not sure of the particulars of that case, but it would have been something like a patient's face swelling up because of an acute infection. The next numbers that are coming up, that's the lockdown, as you might recall, lasted, I think it was just about 2 days. Before then, the announcements came out in the middle of the day that all the lockdown would be lifted. But over that period, out of the 358 incoming calls through that cascade approach, it ended up that only 3 of them needed to come into the Adelaide Dental Hospital. And my understanding is that those 2 that in fact were asked to come into the dental hospital on day 2, it was just because we heard that the lockdown was being lifted. So we thought, oh, well, they can come in anyway. They're the last few calls to come in. So I guess, the proof is in the pudding in terms of results that the system sort of worked. We didn't know. We knew technically it would work, but we wanted to know what effect it would really have. So the benefits were obvious, I guess, from the outset. And patients were, we felt, able to access an appropriate level of management of their concern. We managed to efficiently use resources, tying up valuable specialist time. If we could have a filtration system that resulted in only genuine emergencies requiring specialist consultation, tying up specialist time, that was a good outcome. And things like the medical history being completed online also meant that was not tying up staff time in taking a medical history. The digital pathway, it could essentially be integrated into, mind you, they were adapted SA dental workflows, but it didn't involve having to train all of our staff. It just meant that a few of our staff needed to be trained in Personify Care and the Health Direct video call system. And in fact, it's those handful of staff. So even though we only had one staff member during lockdown actually doing the Personify Care clinical coordination role, and one staff member, that being the specialist, using the video call and the Personify Care platform, is that a number of staff were trained up in that March to July period. And so we had obviously ready resources able to deploy as we needed to. And of course, one of the main benefits when in the lockdown situation is that we genuinely could limit patient movement. If patients didn't need to leave their home, well, we've achieved that. So as I alluded to before, we put into or developed this protocol using Personify Care technology and Health Direct. And we thought, well, we can't just wait for a lockdown. How can we use these technologies? So that's the first thing that we've got up there. Some of the other ways that we've started using these technologies across SA Dental, apart from the lockdown situation. And that's the urgent telehealth consultations to the oral and maxillofacial surgery unit. So a patient could present at an SA Dental Service clinic, with a bit of a swelling being caused by an infection. Now, under pre this pathway, then those patients would have been sent directly into the Adelaide Dental Hospital. And often those patients would present here and they'd be managed quite easily here. And so maybe that was an unnecessary trip by the patient to the Adelaide Dental Hospital. So by having the telehealth consultation pathway, it meant that we would have a specialist at the Adelaide Dental Hospital and conducting a telehealth consultation with the patient at the originating clinic or at their own home if they chose to go back to their home. And a lot of those cases were managed without the patient needing to come into the dental hospital. We further developed that into being able to provide routine telehealth consultations, so not just for urgent appointments, but also for routine appointments. If the technology's there, then start to use it. We also started using Personify Care, so the patient interaction where we were getting patients to provide a medical history, we've taken that one step further by being able to have patients complete their pre-admission documentation to go to the Royal Adelaide Hospital. They do that online now through Personify Care. So it's exactly the same information that's on the hard copy form that the Royal Adelaide pre-admissions unit receives, except it's being, the patient is inputting that information in the convenience of their own home on their smartphone or on their PC, not having to fill out a paper form. Of course, the upside of that is that all of the information is completed. It's easy for everyone to read, and so there's a lot of upside to being able to use that technology for that purpose as well. We've also recently started looking at integrating the Personify Care platform with our referrals process to the oral and maxillofacial unit, OMS unit at the Adelaide Dental Hospital, just for whether it's a routine consultation or a consultation about a potential pathology or wisdom teeth problem, then those patients normally referred to the Adelaide Dental Hospital. We've just overlaid an extra mechanism where that patient now registers with Personify Care, which means when it comes to appointing the patient, that we can communicate with them when they come off the waiting list, etc. We can do that all digitally now. And the ... we're always looking at ways to use these technologies. I think I've chewed up a lot of time, Mark, but we'll hand back to you so that you can talk big picture vision now.
Too bad. Look, I'll keep it brief. We have moved in over the last 2 years to upgrade our end-of-life dental platform. We'd had a dental record electronically for about 20 years. That was at end of life. We had 65 individual instances of databases around the state. We're now at the most current platform in one singular dental record that has over 1.6 million patient records and 20 years of dental history in there. So a very powerful platform to leverage off. We're just starting our digital roadmap because we know enough, but we don't know the questions about where to start for quick wins, but where to start to invest early for those things that might be a long burn. There's a couple of colleagues I know that are on the call here that are helping us on that journey. And we're really looking forward to building something that wraps around our digital dental record that we call Titanium to really manage patient communications, digital bookings, patient and staff experience, and then capture all of the richness of that data. Look to send proactive oral health messages because we very much know that teeth are an early warning system for someone's overall health and well-being. So we're starting this journey. We're looking forward to where this will take us. And I continually remind the team that I shouldn't be the craziest person in the room. And that's my quest to you, is to challenge your leaders to adopt technology early and see the benefits for patients and business workflows. So thank you for your time, and thanks, Michael, for an excellent presentation.